Hi, how do you request a CTPA scan? So we request CTPA scan when we want to diagnose a pulmonary embolism. So did you tell the radio MO that, oh, because the well score is high, request CTPA because D dimer is raised, or ECG showing S1Q3T3, or this is bullshit. Some fella having some sedentary life go to garden for a walk, develop a right lower limb pain, feeling out of breath, palpitation. Does that mean that the fella is having pulmonary embolism? No, right? D dimer is very not specific. Can be raised in a pregnant lady, or infection also can cause raised D dimer. And then coming to S1Q3T3, it is neither sensitive nor specific. So what is the use of S1Q3T3? I don't know, but most of us are still using it. Still finding for it in the ECG. So first of all, you need to know what is the risk factor of developing a pulmonary embolism, coming down to the Burkhouse triad. Stasis, endothelial injury, vascular injury like trauma, anything, or hypercoagulable state. For example, cancer patient, someone's taking OCP, someone with nephrotic syndrome, infection. For example, patient with a lung infection, unable to wean off oxygen for a few days already, has been immobilized for the past 1 week. So that sounds like a pulmonary embolism, right? So infection, stasis, or maybe a cancer patient develop a sudden onset of a shortness of breath, or some orthopedic patient having a right knee septic arthritis, immobilized, tachycardia, feeling shortness of breath. Yeah, these are the history that sounds like a pulmonary embolism patient. Instead of just telling the well score is high or the D dimer is raised, it's very not specific. When you go to request the radiology, might ask you what is the urgency of requesting a CTPA, since I believe that you guys have already started on treatment, for example, some anticoagulant, Claxane, fondaparinux. So here comes the tricky part. So I know maybe the radiology, they are having a very packed schedule or what. So if your scan is really urgent, you need to know what to talk back lah. So you can have a look at patient's HB, FVC. You are afraid of some bleeding is ongoing inside, or maybe you can tell, let's say if the orthopedic team is planning for a surgery for the septic arthritis, so they need to, ideally we will need to rehold the anticoagulant for a few days prior to the operation. So I hope it helps, and next time you don't go to the radiology and ask for CTPA because the well score is high or D dimer is raised, to raw PE because ECG S1Q3T3. Thank you.